Well, a patient with absolute constipation and vomiting for last 3 days. I'm in the epigastric region, and in the epigastric region, except bowel gas shadows. Now this is the epigastric region. What you are seeing is only bowel gas shadows coming downwards towards the umbilicus. Now this is the umbilical region. Longitudinal, all gases, no organ or any vessel is visualized. I have kept the probe in this region for quite some while. The reason being, when we keep the probe for some time on the location, in any location, especially epigastric region, for some time, the gases go away, and it gives you can see the underlying organs most of the time. So in this case, the gases are not. I'm not getting rid of the gases. But anyways, now as I come to the region, lower abdomen, umbilicus, this is the right abdominal quadrant, the left abdominal quadrant, and this is the area lower abdomen. You see, in this region, though the bowels, all the bowels are distended. This is a bowel loop, this is a bowel segment, these all are bowels of food material. This is the bowel with food material, changing its shape. And I move the probe from transverse to longitudinal. So now this is the urinary bladder. This area is the urinary bladder. Here you see small amount of fluid, ascites, and not only here. You see the obstructions. This is the food material. These are all linear structures that you are seeing along the wall are obstructions. Giving a sweep to the probe from the left epichondrium to the lower abdomen. Now, umbilical region. This is the right abdominal quadrant, right side of the abdomen. All the bowel loops are seen significantly dilated, and the movements of the bowel is very slow. Meager movements are seen. And here, small amount of fluid. This is a bowel segment, this is a bowel segment, and there is small amount of fluid between these two bowel segments, and this is what we call as interloop ascites, this one. Here again you will see that this is a bowel segment, this is bowel segment, this is bowel segment. Now this is the fluid. Interloop ascites is seen. There is no other finding seen sonographically. So this is a case of intestinal obstruction with mild perforation at the time of ultrasound impending. It can lead to different changes with the passage of time. This is small amount of fluid between these two bowel loops. So this is a case of, at the present time when I am doing the ultrasound, a case of intestinal obstruction with mild perforation. Thank you.